And there are a few remedies left here and there, some remedies from the Allen's keynotes which are used alongside polycrest or which are used rarely. And there are bowel nosodes and there are some imponderabilias which we need to cover, and we are on the track to cover those remedies. Today we'll take up coffea cruda, and then we will address a few queries from the audience. If you have any questions regarding case taking, materia medica, repertory, rubrics, potency, repetition, follow-ups, ask me when we finish the talk, and definitely I'll get back with more details of my experience and what I have read and what I've understood from different teachers that I have studied under. So Dr. Snehal is asking, explain bowel nosode in detail. Yes, definitely. So in the next few days, we will cover some bowel nosodes and when you can use bowel nosodes, how you can use bowel nosodes. I'll make an elaborate talk over it. To join, it will be around the same time between 5 and 6 p.m. So let's begin with today's remedy, which is coffea cruda. Ailments from the bad effects of sudden emotions or pleasurable surprises. Causticum is another remedy and coffea is another remedy. Many times we get so many good news and we are so much excited with that news that we cannot control our emotions. The next day we are down with some problem. We may not be able to attribute it to the good news because we always associate good news with something that is positively happening in our life, and we'll attribute it to some bad incident, something eaten somewhere, some exposure happened. But it can also be due to this good emotions which have caused a surge in the you know your hormones, and you are not able to control that, your body is not able to handle that threshold. That is why you get ill. Causticum is another remedy and coffee is one of the remedies that you can think of. If it is bad news, exciting news, or something that is apprehensive of also nervous in nature, think of gelsemium. We have been prescribing left, right, and center in all such cases. But coffea for good news and ailments from good news or pleasurable emotions, very rarely. Try to find the cause, trace the cause. How you will trace the cause? That is one of the very, very, very important question. You will have a patient reporting to you within the first day of appearance of his symptoms, and you will just try to understand the onset, duration, and progress. And you will ask him, suppose he reports to you with maybe cough or fever or maybe some severe headache, and you will try to understand if there was any past episode which was similar in nature. Secondly, you will try to understand the cause behind the origin of the problem. Was it cold, hot, or intake or exposure, or was it anything that was deviation? This is what we call deviation from his normal routine, and he'll tell you that nothing he did was of that nature which could cause that disease to start, headache or cold cough or fever. And that's when you can ask, what was your day, how was your day yesterday, or what was the situation around you yesterday or throughout the day today before you reported to me. That's where he will tell you, I was in such a good emotion yesterday, my results got declared, I was so much apprehensive, and the results of my examinations got declared, and I don't know, I should be excited but my body went down. That's where you connect coffea with pleasurable emotions and prescribe. So you have to rule out everything else and then come to the cause of ailments from sudden emotions, good emotions, and pleasurable surprises. You will see that this state will predominantly manifest in tall, lean, stooping persons of dark complexion, sanguine, and choleric temperament. So those who are very irritable in nature, who are very much strongly opinionated, that's where you can think of coffee as a remedy. Unusual activity of the mind and the body, full of ideas, quick to act, no sleep on this account. Weeping from delight, alternate laughing and weeping. The joy which suddenly has been brought by the good emotions or some good news is so much overwhelming the person that he does not know whether to laugh or smile, and everyone has experienced this phase in their life. That's where you should know that this is a coffee state if you develop physical ailments which are of a bad nature. It can be headache, it can be toothache, it can be fever, it can be cough, cold, something that is nervous in nature and may last for a short time. And the surge of the pain or the complaint is far more higher than what you normally expect a functional problem to exist with. So, for that, you need to understand the different functional problems. Like if a person had been exposed to cold air or anything that is of a external cause, then how will the functional changes happen step by step? There is inflammation, there is redness, there is pain, all those things that you study in pathology. And if you don't find those changes and you find directly the nervous disturbances, that's where you can think of ailments from sudden emotions. Patient is uncontrollably out of bounds with his emotions, and you will be able to figure out whether he or she needs coffea or causticum. Oversensitiveness of all the senses, more acute sight, hearing, smell, taste, touch, and everything that is of important sense in the person is hyper exaggerated. This can be a state of a person as a chronic also and in an acute also. Mostly you will see it as an acute manifestation. You know that the remedies which are very similar to this is belladonna, chamomilla, opium. Pains are intensely felt, seems to be insupportable, driving the patient to despair. How do you understand this? This is one of the very important things. You will find innumerable persons commenting and putting up videos left, right, and center with these symptoms or some video, and it's just a lot of garbage in the social media these days. But you need to understand clinically. How will you understand this? Pain seem insupportable, driving patient to despair. You will see a patient enter in the clinic and he'll be writhing in the pain, he'll be restless, he will not be able to answer your questions. You have to understand that. You see people putting videos with this particular symptom with a title that this is how your coffea or aconite or chamomilla will be seen, but you will not be in a position to answer, you will not be in a position to rest yourself. It is such a bad situation. You will feel that maybe this person needs a hospitalization right now. That's where you can think of aconite, chamomilla, coffea, and these remedies which are of high importance or highly acute manifestation of pain intolerance. Belladonna, opium as well, in fact stemmonium also. They are tossing about in anguish. That is what you will understand. Sleeplessness is there, wide awake condition, impossible to close the eyes, physical excitement, mental exaltation. You have to compare also this remedy with Synestia aureus. I have been giving this to lot of patients. In fact, last week there was a case where this person had gone to her native place in Gurgaon from Mumbai, and she was supposed to get her menses, but she didn't get her menses. And I asked her what was it that happened in those few days. She told that there was lot of overexertion due to Diwali cleaning, and I had gone to my native place, my hometown, and there was lot of exposure to dust, and I have this throat complaint. And since that time, maybe I got exposed to dust and cold cough, and I couldn't swallows few things, and I was expecting my periods, but I didn't get my periods. Throat pathology in superimposed in the absence of menses, I prescribed Senecio aureus. Within 2 days, she got her menses. She's all right. So that's how you pick up these small things. It was an external cause, but why did her throat get affected? And even though her throat got affected, her menses were suppressed. So one pathology came up and the other was restricted. That's how you pick up these things. So over here, you see that there is sleeplessness for this particular uh, symptom of Senecio aureus and coffea, which is sleeplessness over here from prolapsus and uterine irritation during climacteric. And there is hasty eating and drinking. They are fast eaters, they are fast drinkers, and you will see this also in belladonna, hepa, and in fact moxol as well. So I see a question from Dr. Snehal. What are the common mind rubrics used in day-to-day practice? I'll come back to this very soon. Next you have is headache from mental exertion, thinking, talking, one-sided as if a nail driven to the side in her brain. Ignatia and Nux are very strong. You can think of coffee also. They will themselves tell you that this symptom has been boggling me and I am affected in this way. Only one side pain is there. That's where you will be able to understand this particular symptom, as if her brain were torn to pieces and worse in open air. Toothache intermittent in coffea. The toothache is intermittent. It comes and goes, not a fixed time. It will be there for few hours, it will be there for few minutes, and it will vary in between. Jerking and relieved by holding cold water in the mouth, and returns as soon as the water becomes warm. You will see this same state present in bismuth, bryonia, pulsatilla, causticum, sepia, and natrum sulf. So in all, you have coffea, which is aggravation from sudden mental emotions, excessive joy, cold, open air, and narcotic medicines. And you can compare also coffea with similar remedies which have hypersensitivity to pain, and all touch and all senses are hyper excited. You will see that aconite is one of the top remedies which runs side by side, chamomilla, ignatia, and sulfur is mentioned as complementary because it is mostly the remedy which completes the action of the other remedies. In fact, recently I had one very interesting case, fever since almost 7-8 days, and the patient had been not getting well so much on lot of remedies, and the case was all bungled up. I just gave a few doses of sulfur, and now the symptoms developed good clarity, and I prescribed the next best remedy, which is Sambucus, based upon his symptoms, and he's totally fine. How will you prescribe these things? How will you understand these things? What remedy to follow the other remedy? There is an entire protocol that you follow, and some things about especially fevers I have discussed in the fever workshop, and I'll be putting up the recording soon. For those who wish to avail, you can definitely get those recordings. As for now, we come to an end for coffea. You have the incompatibility remedies, which is Cantharis, Causticum, Cocculus, and Ignatia. So why incompatible? Because these are remedies which are running very similar in its action to coffea. It is a different methodology to understand, and sometime later we can just discuss about all these relationships of different remedies to understand how to prescribe in different follow-ups. So coming to questions, we see that what were the questions. Explain bowel nosodes. I told you that in few days we'll cover some bowel nosodes, so you can stay tuned. Next you have is something that is about common rubrics in day-to-day practice. So I have been putting up reels which are almost less than a minute, which gives you an idea of something which is non-communicative patient. So suppose there is a non-communicative patient and you don't know how do you ask them questions. They are not replying. They are not, in those cases, they are not cooperating with you. In those cases, you can just keep on observing them and you will get an idea of what rubrics to pick up. It can be timidity, it can be again and again they are just emphasizing on certain condition that they are facing. It can just be simple anxiety health about. So these things are very subtle. It is not always that the patient will tell you that I feel better when I go out in open air in my anxiety. This is not going to happen, believe me. So this is one type where you will see common mind rubrics. You will see timidity, you will see someone who is boasting, you will see someone who is kind of very anxious, you will see someone who is not having good concentration. He will tell you himself. Basically, there will be patients who will tell you few things about themselves where you can take those rubrics. There will be some cases where you will have to observe, and it will be a combination of objective and subjective symptoms which you can form into rubrics and understand from the repertory how do you repertorize and bring come to a totality. So it's a wide range of things, and maybe I'll take some ideas from your questions and bring out something which will be beneficial to you, so you can stay in touch. How to study materia medica, how to remember mental symptoms. Both questions are different, but I'll try my best. How to study materia medica? In fact, SAK074, you have asked this question, so I want to tell you that you can go through all the Allen's keynote sessions that I have taken in the last 3 to 4 months. I have basically given a glimpse of how you should study homeopathic materia medica and how I have just taken remedy after remedy which are related to the previous remedies or which follow well, and how they have been in comparison with the previous remedy or the group of remedies that I will be discussing. And that's one of the way to study materia medica. There are many different ways. You can just pick modalities of different remedies and study. You can just pick up, for example, boric materia medica and study the generalities. There are innumerable ways. You have to try to be creative, what suits you, and use that method to practice. How to remember mental symptoms? There is no easy trick to fix this. Just read the repertory like you read the materia medica. Sometime in future I'll be taking up the different rubrics as well for you to understand, and what will be common and uncommon rubrics. Maybe something that will help. We will come up with something. Can sulfur, if indicated to patient if he has chronic skin disease, can we give sulfur in high potency? In LM potency he took 200 but not improvement. I would say that you will need to understand whether the patient has the similimum in sulfur. If he fits the bill on the mental level, on the physical level, on the thermal level, maybe your remedy is right and you can prescribe in a higher potency if the lower has not worked. Medicine for knee pain has osteoporosis, osteophyte, meniscal tear. Patient on prolonged standing, ascending stairs feel better on rest and sleep. This needs a complete detailed case taking. If you can message me, I will definitely get back to you with something that would help you. So you can send me the details of the case and I will definitely try to look over and suggest you something. So that's what we sum up today's session with coffee and a few questions. And in the next few days, we will undertake some of the bowel nosodes and something that is going to be beneficial from a different point of view from Allen's keynotes.